Back in the early 90s, the ADA Government Relations Committee here in Minnesota became very concerned about the fact that there was very inconsistent or lacking coverage for diabetic supplies.
And we're talking about test strips for diabetes, as well as some of the medications that people receive.
People would find out that, for instance, their insurance company might cover a bottle of insulin, but they wouldn't cover the syringes to deliver it, or they wouldn't cover the test strips that people need to test their blood sugar and find out how much insulin they should give themselves.
That was very difficult for us to hear because we knew what the repercussions of that could be and the ill health that could result when people couldn't get access to the tools they really needed to manage their disease.
We were in a situation where testing was proven to be helpful and yet not readily available.
And so at that point in time, Minnesota Care legislation was coming forward, and there was really a concern from everyone across the board, our patients and diabetes educators and others, would there be coverage for diabetes, patients with diabetes?
So we worked hard to try to do what we could, even if it meant changing laws, which is never an easy thing to do.
We sponsored at least a couple of days on the Hill where we would have patients come in, families and kids. We had buses that would take people from our conference room over to the Capitol, and before we'd send them up there, we would train them on their talking points and then turn them loose on the Capitol. And so it was really a neat grassroots effort, where families were able to tell their story.
And just the whole process of getting that bill into place was so gratifying. It was really showed me how people working together can make a difference.
I think after the bill was passed, we were extraordinarily proud, and I think it was a very significant piece of legislation that really has helped thousands and thousands of people with diabetes across the state.
And what that meant to the patient was they were now getting the knowledge and the skills and the confidence that they need to manage their diabetes.
Minnesota really was out in front, and we set the standard for the rest of the country in a way.
And now there are 46 states, and so we feel like we were early leaders in this movement, and we feel very proud to have helped spur other states to do the same thing.